Hi, this is Dr. Davis. I made this video to show you the difference between traditional cataract surgery and cataract surgery using the computer-guided femtosecond laser. In this still photograph I've chosen, you can see a dense white cataract having surgery. The blue is the anterior capsule, and it's been stained with a blue dye to make it easier to visualize. The art of the surgery is to tear a circular opening in this membrane, which is stained blue in this picture. Let me now show you some live video of surgery where the circular tear is being made manually. Here we see an eye with a nice red reflex. This view is through the operating microscope. The instrument on the right is called a cystotome, and it's essentially a sharp needle, and right now it is being used to make an incision in the anterior capsule. This patient is able to move his eye freely, so the instrument on the left is actually holding the eye still while the capsular flap is developed. Irrigation to improve the view is then performed, and using this special forceps introduced through the incision, the capsular flap will be grasped and a circular capsulotomy will be completed. At the end, you will see there is a relatively perfect circle torn in the anterior capsule. Here is another example of a manual capsulotomy where the end result ends with a very nice circular opening in the anterior capsule. This is done manually. Optimally, the capsulotomy should be 5 millimeters and a perfect circle. You can imagine this is very difficult to do on a consistent basis manually, although I am fairly skilled with this procedure. This patient was able to fixate on the light very nicely, holding the eye still, making my job that much easier. Now you are seeing the computer-guided femtosecond laser making a perfect 5 millimeter incision in the anterior capsule. The bubbles that are forming are the laser at work. You'll notice that the eye is very still because the laser actually uses suction to hold the eye in a perfectly still position. To the right of the screen, you will see the imaging system that's used to guide the placement of the perfect 5 millimeter circular incision. And now let me show you why it's so important to have a very good circular anterior capsular opening. This is the space into which your new implant goes that replaces your cataract. In this video, you can see me inserting a new intraocular lens into this eye, and it's going to go into the capsular bag through the 5 millimeter circular opening. The accuracy of that 5 millimeter circular opening helps us know that the postoperative refraction, or what the patient will see without glasses, is going to be consistent and reproducible. The anterior capsular opening is critical in holding the intraocular lens in the correct position, making sure it doesn't move out of position, and also making sure that the postoperative results are what we want. You can see this can be done manually, and I've done thousands of cases this way. A new generation of technology guarantees accuracy in this portion of the procedure. Now I think you can understand why I believe this is a tremendous breakthrough in cataract surgery. Thank you for your attention.